A healthcare practice keeps its doors open. As the COVID-19 pandemic took hold, many healthcare providers faced a decision they never considered: closing their practice and furloughing staff. When COVID-19 cases began rising across the country, many healthcare practices and providers took extra precautions like limiting the number of in-person visits. Additionally, some patients stayed away because of stay-at-home orders, fear of COVID exposure, or because they assumed their practice was overwhelmed by COVID cases. It was a perfect storm of circumstances that devastated many healthcare organizations. The significant drops in revenues from seeing Medicaid, Medicare, or privately insured patients meant they had to consider how they would remain in operation. Things started looking up when the U.S. government's Provider Relief Fund program was introduced. Despite some reservations by providers who had never applied for government financial assistance before, providers began to explore the opportunity. They found the application process easier than expected. The flexibilities in how they used the funds were broad, so long as they could prove it was used towards COVID-related expenses and lost revenues. COVID-19 has had devastating implications for healthcare providers nationwide. While the Provider Relief Fund program will not solve all the challenges providers are currently facing, it can offer some peace of mind and help to keep the doors open, helping to maintain the necessary presence in communities nationwide. To apply for financial assistance through the Provider Relief Fund, visit cares.linkedhealth.com.
Produced by the U.S. Department of Health and Human Services at taxpayer expense.